For me, from a very young age, there was a lot of things I was not allowed to do because I'd go and play outside and come back and have a crisis.
Honestly, I feel everyone that sees me wouldn't want to treat me as like someone that's actually going through serious complications just because of the way I look.
Sickle cell disease is really a group of disorders. They're inherited. You all know, I'm sure, that we are made up of proteins, and the proteins are coded for in the DNA, the genetic material that we inherit from our parents. And sometimes there's a little change in the genetic material, which makes a change in a protein, makes the red blood cells, which are the cells that circulate around our body and carry oxygen to the tissues, it makes them behave in an unusual way. Such that when they are exposed to low oxygen conditions or high temperatures or more acid than should be, they twist up. So normal red cells, ordinary red cells, are squashy, round things, a bit like a donut with a little gap in the middle. Sickle cells are like that, but in people who have the main condition, under these conditions, they twist up. And it's that twisting up that causes all the range of problems which we'll talk about for people with the condition.
From what I can gather from my mum, she wasn't aware that she had sickle cell. She only became aware she had sickle cell when she had me. So for her, as a trait, she didn't really experience any sort of illnesses that needed investigation that would give her that diagnosis.
The most important genetic change makes the hemoglobin, which is the red protein we're talking about in the red cells. It's called hemoglobin S, and if you inherit that gene change from one parent, you don't have any illness. You're called a healthy carrier for sickle cell because you can pass it on to your own children. If you inherit S type from both your parents, that's when most of the problems, so hemoglobin SS, both parents, that's the worst form of the condition. 2 healthy carrier parents will have, for each pregnancy, a 1 in 4 chance that baby will have sickle cell anemia.
In the sickle cell community, everyone's different. They're all going through different things because not one size fits all, and one person might have sickle cell worse than someone else does.
So there are 3 sort of main categories of problem, really, kind of interlinked. The first is that in SS, particularly the more severe kind, which as I said is called sickle cell anemia, the red blood cells don't last nearly as long as they should in the circulation. So the normal red cell span in ordinary people is maybe 3 months. And in people with sickle cell, it's more like 10 days. So the red cells are constantly breaking down and the bone marrow is constantly having to make new ones. But even with the bone marrow working as hard as it can't quite keep up. They tend to be quite highly functional, but certainly would fatigue more easily. So that's one thing.
Growing up was tough. Teenage years was very tough. For me, from a very young age, there was a lot of things I was not allowed to do because I'd go and play outside and come back and have a crisis. So my mum, although she didn't mollycoddle me, would not let me go out and play with everybody else. But when you are in your teenage years, you want to be like everybody else. And it's very hard when things are planned, birthday parties, you've known in advance, and on the day, you can't go. And that was really difficult for me when I was a teenager to come to terms, and I felt like my life was restricted.
I used to be treated like an egg when I was growing up. Like, people that understood my situation, they're like, don't do that, something could happen. Like, that's all I've heard. Like, even it took a while, like, for me to actually like play with my cousins because because right after I had my first stroke, I had to sort of prove myself I'm capable of doing things. You feel really bad, like you want to get involved.
There are a variety of reasons why people with sickle cell can't handle certain sorts of bacterial infections as well as other people. And in sickle cell, from babyhood, the spleen gets damaged as little blood vessels get blocked by these twisted red cells, and they're at risk from overwhelming infection from earliest infancy. And that's why it's highly recommended that from 2 months, 3 months of age that they start on twice daily antibiotics, penicillin, have all the vaccinations. So that's the second one. And then the third one, which is for many people the most problematic, is that when the red blood cells and a host of other blood cells all join in, twist up, they can jam up the tiny blood vessels that feed blood and therefore oxygen and nutrients to all of our tissues. And when a blood vessel blocks, the bit of tissue that it should be taking oxygen to is damaged. It screams out, if you like, for lack of oxygen and lack of nutrients. And there's local swelling and inflammation, and that gives terrible pain, which mostly occurs, it can occur anywhere in the body or even everywhere in the body or all at once. And it's the bone marrow, as I say, crying out and swelling up for lack of oxygen and nutrients. And that's called the pain crisis.
For me, it's like a pain like no other. I can't describe it. It's like somebody constantly hitting you with a hammer. It's sore and they're constantly hitting you with a hammer. And it sort of rapidly spreads through your body. So you can have a crisis that will start maybe in your leg. You feel the pain in your leg, maybe in your knee, in the joint. But by the time, give it 2 hours, your whole body is in total pain and agony.
It's like something ripping a part of you and then like putting something sharp through that point. Sometimes it's like just a sharp pain, and then it's like sometimes when I would breathe, the pain will get sharper.
And for, as I say, for many people with sickle cell of all sorts, but particularly SS, that's the most troublesome and the most prominent and difficult feature, because these crises can be brought on by things that are recognised. So if the weather's been warm and suddenly it cools, or it's been warm and it's suddenly wet, or swimming in cool water and not getting dried adequately, infection and fever, exposure to low oxygen, exposure to actually stress, personal stress, can precipitate this crisis. But sometimes it comes out of the blue and there's absolutely no knowing.
A lot of people, myself included, when I'm in pain, I don't want anybody around me. I just don't want to be touched. I just want to be left alone to go through it. So it becomes difficult for people around you watching you. And slowly, especially if they're not family, they just, disappear, because they can't keep watching you go through something where they can't help you. But when you're young, you don't understand that and you feel very isolated. So it can be a very isolating illness. And on a normal day, someone will see you and think, oh, there's nothing wrong with you. I mean, I could be well in the morning and be completely ill in the evening. And people don't know how. But you were okay. There's no telling.
Many people manage pain at home, but more severe pain will usually require hospital admission and very strong painkillers.
When I get pain, I'm normally doing something. I might be out, so I don't like to show how I'm feeling outside. So I'll just clear my mind and just try to take deep breaths and try and calm myself down, sort of thing. Because I find that sometimes when I calm myself down, it becomes more bearable.
We were talking about blocking the little blood vessels can cause a whole host of additional complications. So you can block vessels in the lungs, a dangerous complication called acute chest syndrome. You can block them in the kidneys, the liver, the gut, The brain we'll talk about a little bit later, perhaps regarding stroke, but anywhere in the body. So individual organ damage is an accumulating problem often as people go on. I should just say, not everyone with sickle cell has pain, but the majority do, and about 1 in 5 people have recurring crises.
When I was a child, it was like a vicious cycle. So I would feel a crisis coming on, and the fear of this pain will actually send me into a crisis. The fear of, oh, I'm going to have this pain again, will actually exacerbate the crisis. I didn't know how to deal with it very well, and therefore I was constantly one crisis to another, one crisis to another.
And as people get older, the pain tends to become more persistent. So as you've damaged joints, particularly the hips, shoulders, spine, quite often by the middle years, people have more or less chronic pain.
Because someone with sickle cell, they're going through pain all their life, the pain threshold, it gets higher and higher, so they start being able to tolerate more and more pain, and that's not good. Because a child looks okay, they might not understand that that child has actually built up a big tolerance to the pain they're going through. So by the time they've let the teacher know that they're in pain, it's not just a normal kind of pain. It's a really severe pain that they had to let you know. So sometimes teachers are thinking that they just don't want to be in school kind of thing.
I've learned relatively recently how people with sickle cell anemia particularly probably have some pain more or less every single day. They just don't go on about it. And the reason I know that is because talking to people, for example, that have had bone marrow transplant, which can now be done to cure sickle cell, actually it's the actual cure, more coming along, say the most amazing thing is I now wake up in the morning and I don't have pain, and that's new to me. And I don't think we as a profession really kind of clock that, because people don't tell you about mild pain, they tell you about really bad pain.
For me particularly, as I've understood that my life expectancy can do things and this is not determined by this disease, and growing up and understanding my body and understanding things that I can do to help myself to try and prevent these crises or to lessen the impact of this crisis, that fear has been removed, and therefore even when I have a crisis, although it's painful, that fear and anxiety is no longer there.
Stroke, you know, in people in general, often occurs in middle and later years, and it's in people with high blood pressure, diabetes, blah. In sickle cell, it's very unusual in that it's predominantly in children. And it's about 200 times more common in children with sickle cell anemia than it is in stroke in childhood. It's very rare normally, but it's massively more common. So that somewhere up to 10%, even 20%, if you go looking with scans of children by the age of 20, so by the time they're adults, will have evidence of a stroke, either clinical, which presents like an old person's stroke with weakness in the arm, leg, difficulty speaking, writing, so on, or sometimes with fits and other different symptoms. And it's commoner from the age of 2 through till the age of 6 or 8. So a devastating thing to happen to children. And even those that don't have very severe physical damage may have some learning difficulties resulting from that.
A few years after I had my first stroke, got into playing basketball, and I wasn't allowed to play any close contact sports, any football, basketball, ice hockey. They said I couldn't do it because obviously something happened, someone pushes me over, I hit my head. It could be fatal.
So when I started in my practice in 1990, it was an absolute horror, because it's not always even the same children that get the bad pain crises that get the strokes. So a little child that you'd seen in clinic, doing well, the next thing they come in with this stroke, and there was no way of knowing which child it was going to be. Even then we knew how to treat it, which is with urgent blood transfusions, and that to a varying degree reverses the problems if it's done very, very quickly.
Because I have a high percentage of red blood cells that are sickled, I need to have blood transfusions.
First up, we should all be donating blood if we're well and young enough to be acceptable to the blood transfusion service. Second of all, you don't have to not have any sickle cell. It's fine to give blood if you have sickle cell, what's called the trait, the healthy carrier state, because you're a healthy person and you can donate blood. That blood shouldn't be used for people who have sickle cell that need blood transfusion, but it's great for everyone else. And of course, those sickle cell affected people have a much higher requirement for blood than people in general. All of us can have operations or car accidents and need blood transfusion. So encourage everybody you know to donate blood.
Now I do blood exchanges. What that does is it takes out the red blood cells that are sickled and it gives me new blood cells that are normal shaped. And what this does is it takes away the sickle cell percentage, and I just feel like a new person every time, honestly. That's why I think that blood donations are actually very important.
For people from the African and Caribbean communities, it's doubly important to think about donation because people know about the blood group system and they say I'm O positive or A negative, and ABO and positive negative are the sort of main proteins on the red cell surface we're talking about now. We've been talking about the proteins inside the cell, the hemoglobin, but now we're talking about the surface.
Every time I was pregnant, I had to have blood transfusions, exchange transfusions, so many transfusions. And I've come to this point in my life where I can't have blood transfusions. My body has built up so many antibodies against the transfusions that when I have a transfusion, it sort of sets me back rather than help me. And it's important, extremely important, that we as Black people give blood because we are closely related.
But there's a host of other protein types, and actually they're to some extent ethnicity dependent. So there are some patterns of surface proteins that are particularly prevalent in the African Caribbean community, much less prevalent in other donors. And the problem is, if you are given subtly not quite fully matched transfusion red cells, then your body recognises that they're not quite you, and they go, whoa, no, I don't think so. And your immune system kicks in and makes antibodies as if it was like an infection.
My work colleague, and she's British, white British, from the day she found out that I had sickle cell, has been given blood on a regular basis, and I mean regular basis. And I can't get my Black friends to do it. And although we appreciate it, like we need it, a lot of sickle cell patients live with their transfusions, help them to live. But if you build antibody to it, then it becomes a problem. So I have a friend that if she is transfused today, she basically will lose her life.
And the management consists of, first of all, resting. Second of all, fluids. So one thing that actually undoes, to some extent, the blockage in the blood vessels as much as it can be undone is really hydrating yourself. So people with sickle cell are advised to drink more than ordinary people all the time. So maybe 3 litres for an adult. So really constantly you see people with water bottles. Incidentally important for school teachers and so on to know that that child must be allowed to drink water in the lessons, must be allowed to go out to the toilet. So it's a little bit of education in schools is really, really helpful. Many people manage pain at home, but more severe pain will usually require hospital admission and very strong painkillers.
Although I was born here, growing up in Ghana, I think for sickle cell treatment at the time, it was basically you go into hospital, they give you a drip, so they managed it with your diet and your paracetamol and stuff like that, folic acid, list of drugs you take. When I moved over here, it was more of very serious drugs that I'd never taken before. And I remember my first crisis when I went into hospital, I was put on a morphine pump. And bearing in mind that I had grown up taking paracetamol, it immediately hit my system and I could not hear or see at all. And at the time, the the registrar I was talking to was like, well, this is the treatment we give to sick. And I said, it's not working for me. I can't hear. And he was talking to me, and I was like, so why am I talking to you and not listening to me? And I was like, I can't hear you, and I'm not seeing you. It's like, oh, well, this is what you've got to take. With my doctor back home, I could tell him when we went to see him, he would never allow my mum to speak. He always wanted to hear from me what was wrong with me. And so I've always been used to saying what worked and what didn't work. That was the first time I met Dr. Yadumin, because they came on a ward round. They had been talking to me, but I wasn't hearing them. So one of the doctors tapped me, like, are you okay? Are you asleep? And I was like, no, but I can't hear you. And I can't see. Go, have you said anything to them? I said, well, I did. But so immediately they took it off. And since then, I've never had morphine.
I don't like going to the hospital. I don't think anyone likes going to the hospital. So I'd rather see if the pain will go after a while than call an ambulance. But there have been a few times, like quite a few times actually, that I've had to call an ambulance and I've been in my room, I'm lying down trying to just forget about the pain, and it's getting worse and worse, and I just say to myself, you know what, I have to call an ambulance.
When the pain is raging, it has to be managed on time. So if it's 2 hours, it has to be maybe before the 2 hours or dead on 2 hours. So when it's like 2.5 hours later, your pain is all back to square one and you've got another mountain to climb.
And then there's a whole area which our service users will be able to describe to you more eloquently than I, though I regret to say I absolutely acknowledge, and I've seen too many examples, which is how, when somebody with sickle cell comes into hospital with pain or with another symptom, how often they don't seem to get the care that you'd want. And, you know, London casualties are busy, and we know everybody's under strain, and COVID has made it even worse. But this predates COVID. This is not a pandemic phenomenon, that somebody may come into hospital and one of the staff may go, pick up the telephone, I promise, one of your sicklers is here. Like, who? What are they complaining of? It's just like a whole bunch. And they're told to sit down and wait. And, you know, most casualties or most hospitals will now have a system whereby you can look up patient A. The system will tell you patient A is allergic to this, they need this. The standard is give painkillers for somebody who attends in acute pain within 30 minutes. If you do an audit of how many people get it within 30 minutes, it's not great.
A&E is the worst thing. I think especially for someone that's going through a chronic condition, to keep going to A&E. My last experience in A&E, I got there at 12 o'clock. I wasn't seen till 5 a.m. They don't treat crisis with importance as they would like you having a stroke. But the thing is, crisis is just as important because you're in just as much pain as if you were to have a bleeding in your brain. It will hurt just as much as you having a crisis. So yeah, I just think for them, they just care about whether you're going to live or die. And that's what they treat as important.
It was a regular occurrence on the ward that you would ring the bell, nobody would come. Or the nurse will come and say, you're not my only patient, you know, there's other people to worry about. You sickle cell people think that the whole ward is yours. And for me, I just recall into my shell and just, you know, just lay there and wait for whenever they can get to you.
I remember there was this time I was in uni and I had a crisis. And I had to go to a hospital near there. But that isn't my hospital. I wasn't registered there or anything because they didn't understand how to treat sickle cell patients. They weren't treating me as well because I was in hospital on the bed. I was still in pain. They were giving me medicine, but they were giving me such a small dose that the pain wasn't subsiding.
It's very hard to see others being treated right. and then you get treated a certain way because of a perception they have. So I developed this, will I say mistrust? I have to know exactly what you're giving me. When the doctors come round, I am asking exactly what I'm going to be given. So when the nurse comes round, I'm asking you exactly what you're giving. I want to see, because I just felt like they could easily make a mistake with me and not care, because she's a sickle cell patient. Oh well. So I developed that, and even if I'm in the worst crisis, I always try and keep my mind alert. It's difficult and it's shameful, you know. I've had so many horrible experiences.
Honestly, I feel everyone that sees me wouldn't want to treat me as like someone that's actually going through serious complications just because of the way I look. You do get that empathetic feeling. You empathize with the person and you feel bad, you feel like you have to do something if you can. But whereas if you were to see me, you wouldn't feel like you have to do something. You wouldn't, unless you actually understand my story and what I've been through, you wouldn't really know that I need help.
It's inexplicable why, for example, they are still having to pay for each and every prescription. They are always going to need a supply of antibiotics. Either they take it twice every day, or at least they have it on hand. They're always going to need some painkillers. And actually, even the ones that we talked about, paracetamol and brufen, some GPs say, oh, you go and buy it. Actually, if you're buying those all the time, they're not cheap, actually. So at the very least, they can prescribe a decent supply.
I'm not saying type 2 diabetes is not, but people get type 2 out of a lifestyle choice, you know, not taking care of yourself properly and stuff like that. I didn't do anything to get this disease. And they get better treatment. They get free prescriptions. They get in front of the queue. They can say, I'm having this, and everybody stops. It doesn't happen with us. I pay for prescriptions and we take a lot of medication.
It is a bit hard sometimes. Doctors don't really understand because they think you are either abusing the medicine or you're dependent on it or something like that, but that's not what it is. It's just simply we're in pain. We need the medicine to get out of pain.
And it's too individual. It really needs to be a proper systematised treatment. It's like, who's the first person that you bump into in the casualty? And if it's a nurse you know, or you see your familiar doctor on your team, they'll come along straight away and get it all sorted. But if you don't, you may wait, honestly, hours. And it's unforgivable, as well as dangerous, actually, because the pain is terrible and really needs prompt analgesia. And it's so satisfying when you get it right, because within an hour, somebody's now resting.
I just want basic respect and understanding that this is not of anybody's doing. For me, in spite of sickle cell, I have to live. And I might take time to do things. It might take longer for me to do things, but I'm going to do it anyway. We have home care nurses who come, and I keep mentioning Dr. Yadumin. She was our consultant for a long time. And we set this thing up with her where if you are somebody who doesn't have a lot of crisis, but you have pain, you can have the nurses come home, administer painkillers, so that you can be in the comfort of your home. And for me, it was a brilliant thing, because it meant I could live, work. I could come from work, be unwell the next day, and a nurse will come home, which means I could go to work the next day, or rather than be on the ward, be attached to drips and stuff like that, and trying to get out of those drips becomes a challenge. So it improved my life, and now it's going to be cut for no reason. We've not been consulted. we've just been told, well, we're pulling that service back. And these are the things that we just want to be treated like every other patient.
There's always light at the end of the tunnel, because the sort of things that I've overcome in my health, doctors wouldn't have thought that I could overcome it. So I know there are miracles that can happen. So anytime I'm in a situation that I feel is the end, I always know it's not really the end. It's just a test to make you stronger, and that's how I view life.